This evening, we have a unusual approach to interviewing fellows. We get to interview a number of them at once with their mentor. Dr. Yousef, let me begin with you. You are the individual responsible for training the fellows in Amman, Jordan. Please, will you tell us about this training, about the facility that you have, and your experience in training the fellows?
Thank you very much, Mr. Henry. And it's my pleasure again to meet all my friends. Actually, I will not call them my fellows, but they are my dear friends. Before telling about my service, which is the ocular oncology and retinoblastoma service at King Hussein Cancer Center, I would like to introduce briefly about King Hussein Cancer Center as a center in Jordan. The ocular oncology service at KHCC was established in 2003, and now we have a huge team that consists of ocular oncologists, ophthalmologists, radiation oncologists, pediatric oncologists, ocular pathologists, ocularists, and others. And King Hussein Cancer Center actually is the single cancer center, and actually it is the single center treating all cases of eye cancers in Jordan. And because we want to help people to treat retinoblastoma in the countries around us, as we do in Jordan, we have established the Ocular Oncology Fellowship Program in 2014. Our target from this fellowship is to train young ophthalmologists from these countries to go back home to treat patients in their countries in the same way that we do in KHCC, targeting having success in their countries in the same way that we had in Jordan.
Thank you so much, Doctor. That was very informative. Now I'd like to hear from each of the fellows, giving us a short summary of the status of retinoblastoma and eye cancer in your country and what you're able to do to assist your patients.
I'm very indebted to the ECF, the Eye Cancer Foundation, to the ICO team, to Dr. Yacoub and the entire team at KHCC. It was truly a very enriching experience. The concept of ocular oncology in Pakistan, it never existed. There was no such thing. I mean, nobody knew that this was a specialty and it can be taken up as a specialty. And over here, the place where I work, it's a trust hospital. It's a free of cost hospital, and we are burdened with a very vast majority of patients, especially coming from far-flung areas, from rural areas. And when they present to us, they're presenting at very advanced stages. So before my fellowship, we were just referring them here and there. We really didn't know what to do. And as far as retinoblastoma was concerned, okay, this is retinoblastoma, answer is either enucleation or palliation. So when I took the fellowship and I went to KHCC, it was a whole new world. Like, I opened my eyes to like a new world, really. I was not expecting. So there is an outpatient day in which I was exposed to patient care. I was seeing patients. I was involved in discussions. And then, of course, there were OR days. So, I saw plaque for the first time. I'd never seen plaque, just read it in books. When I came back, the first thing I did was I called Dr. Yacoub to my city. And then he was very, very successful, actually establishing what ocular oncology is and establishing guidelines. From there, after that conference, now I'm getting consultation from 2 or 3 government hospitals. And that's why now I'm being double burdened with the number of cases that I'm getting. So from all the pediatric oncologists, they consult me, they refer the cases to me. So now I have established oncology services here. And I have actually, I'm successful in actually getting people to know that it's a subspecialty and it just can't be, it has to be dealt with professionally.
You are a true pioneer. That's fantastic. Who's next?
First of all, I'm very grateful for Eye Cancer Foundation to allow us to get this fellowship. And I have experienced a hands-on surgeries with Dr. Yacoub regarding brachytherapy, focal therapy, and how to manage the patients, all the treatment modalities, and many complicated cases we have managed an approach of treatment for them, and I sharing the direct contact with the patients and in addition to treating them. So the main obstacle in Syria that prevent retinoblastoma surfaces from going forward is the lack of medical team that are well qualified with this subspecialty. Is not available of the instruments or infrastructure. It's only the knowledge. There is no qualified knowledge in retinoblastoma services there in Syria. But for myself, I'm hoping to come back to my home country as soon as possible to apply these services that I have learned.
Thank you very much. Next, how about Dr. Musallam?
Yes, I am Dr. Muhammad Musallam. I am from Gaza in Palestine. I'm really happy to have this meeting with my colleagues and my mentor, Dr. Yacoub. I did my residency program in the Jordan University in Amman. After I finished my program, my fellowship, I went back to Gaza around 1 year ago, and I started my job in the Ministry of Health. I did another fellowship before I came back to Gaza in veterinary surgery, and we are trying to establish a team, a comprehensive team, at least from pediatric ophthalmologist and oculoplastic surgeon and veterinary surgeon, to at least to know the cases that have retinoblastoma, so that we can go for other issues of retinoblastoma and deal with the family and not only the people, not only the patient. I want to emphasize that it is not only clinical education, it is not only research, it is how to deal with a patient as a human being, how to deal with his family and his parents. This is an important point for me.
Thank you very much, Doctor. Can we hear from Dr. Isra Mohammed from Sudan?
I am very much inspired by the experience in Jordan and the very good outcome in retinoblastoma patients. We are still facing so many obstacles, but I believe when you have the practice and you have the belief, you can make something actually. And maybe one day we will have the proper protocol that is established in Jordan, and one day maybe we have the very good outcome I have seen there. Now we are inoculating like 99% of the patient's eyes, but we are doing something to change all this. So that's all.
Well, thank you, Doctor, very, very much. And I also want to say to those who will be watching this, that as you heard, the key to the success of this is your donations. We ask you to be generous. We ask you to help us continue this work and continue to bring new fellows on board. Doctors, do you have anything else to say?
I would like to thank you, Mr. Henry, and definitely I thank Dr. Finger, my mentor, my boss. Telling you something, I was Eye Cancer Foundation Fellow and ICO Fellow with Dr. Paul Finger in 2011,
Wow.
which is ago. And you became the fellows, and in the future, you will be the mentors for more and more fellows. And by that, the knowledge will distribute all over the world.